Today, let's talk about an emerging entity with distinct clinic and pathologic features, which make it easy to diagnose if you are aware of it. However, if you don't know about it, it can cause diagnostic difficulty and even misdiagnosis, as the list of differential diagnoses is long. This entity, pseudoendocrine sarcoma, was first described and named by Dr. Flectcher in 2022. Pseudoendocrine sarcoma can closely mimic neuroendocrine tumors. If unrecognized, it may be misclassified, hence the importance of awareness. Morphologically, the tumor resembles a neuroendocrine tumor. The tumor cells can show pseudoglandular, nested, trabecular, and sheet-like growth pattern, just like neuroendocrine tumor. The tumor cells are epithelioid with eosinophilic cytoplasm with round nuclei and speckled salt and pepper chromatin. So, under the microscope, it looks neuroendocrine, but the immunoprofile and clinical presentation do not fit that diagnosis. Pseudoendocrine sarcoma has a distinct immunoprofile. The tumor cells are negative for all cytokeratins, AE1/3, CAM 5.2, EMA, pancytokeratin, therefore classified as sarcoma, not carcinoma. The tumor cells are also negative for neuroendocrine markers, synaptophysin, chromogranin, INSM1, therefore it has pseudoendocrine in its name. Nuclear beta-catenin positivity in all but one reported case. If you encounter a soft tissue tumor that looks neuroendocrine but is negative for cytokeratins and neuroendocrine markers, and it shows nuclear beta-catenin positivity, think about pseudoendocrine sarcoma. Pseudoendocrine sarcoma is a rare entity with fewer than 40 cases reported so far. It affects patients of wide age range from 29 to 86 years, with mean age of 64. It occurs most commonly in paraspinal region. Others anatomic sites, such as back, thigh, inguinal area, and orbit, are also reported. It behaves as a malignant neoplasm with potential for recurrence and metastasis. Macroscopic examination typically shows a lobulated, infiltrative mass with white to fleshy cut surface. Invasive growth is often obvious. Some cases invade into bone. Microscopically, it closely mimics neuroendocrine tumor. The tumor cells have moderate eosinophilic cytoplasm with round nuclei and speckled chromatin. Different growth pattern, including pseudoglandular, linear with myxoid background, sesamomatous calcification, and even osseous metaplasia can be seen. But for all cases, the neuroendocrine morphology is consistently present. In summary, pseudoendocrine sarcoma morphologically resembles neuroendocrine tumor. The tumor cells have eosinophilic cytoplasm with round nuclei and speckled salt and pepper chromatin. Mitotic count varies from 1 to 29 per 10 high-power field. Necrosis is not seen in all reported cases. Invasive growth, including invasion into surround soft tissue and bone, as well as lymphovascular invasion, are present. Immunohistochemically, nuclear positivity for beta-catenin is present in all but one cases. All cases are negative for cytokeratin, synaptophysin, chromogranin, INSM1, and SOX10. CD56 is positive in all tested cases. We know CD56 is not specific to neuroendocrine tumor. A subset of cases show focal positivity for desmin, CD34, CD99, and androgen receptor. The list of differential diagnoses is long, including neuroendocrine tumor, paraganglioma, glomus tumor, round cell sarcoma, myoepithelioma, and solid pseudopapillary tumor. The characteristic immunoprofile including negative for cytokeratin and neuroendocrine markers, and nuclear positivity for beta-catenin, helps distinguish pseudoendocrine sarcoma from other mimickers. At molecular level, mutations in CTT-NNB1 gene is present in all tested cases. To wrap up, pseudoendocrine sarcoma is a rare soft tissue tumor that predominantly occurs in paraspinal region. It has characteristic morphology and immunoprofile. If we see a tumor with neuroendocrine morphology but is negative for cytokeratin and neuroendocrine markers and shows nuclear positivity for beta-catenin, we should think about this entity. Here are the 2 articles that nicely summarized clinical, pathological, and molecular features of this entity. If you want to learn more about pseudoendocrine sarcoma, check out these 2 articles.